Hello, everyone. My name is Fawad Haddad, and for my pharmacology drug class deep dive, I chose to be presenting on a widely utilized class of medications known as statins, or more scientifically known as HMG, CoA, reductase inhibitors. So let's begin with the introduction and classification of what my drug was. So statins are one of the most frequently prescribed drug classes in the world, and their primary therapeutic purpose is to help aggressively lower elevated serum lipid levels in the body and stabilize the endolethal blood vessels, which specifically helps to reduce the risk of major cardiovascular injury or disease, such as heart attacks or strokes, which could tend to be fatal. For the context of the presentation, there are two specific prototype drugs we'll be focusing on. One being the atorvastatin, which is more commonly known as Lipitor, and the rovastatin, which is more popularly known as the Crestor. Moving on to the mechanism of action, this is where the drug's impact on our body's internal biochemical systems are particularly fascinating. So, actually, at the molecular level, statins work by competitively inhibiting the enzymes HMG CoA, reductase. And as you can see in the diagram, this is critical for the rate limiting enzyme located in the mevalate pathway, which is now responsible for the endogenous synthesis of cholesterol in the liver. And as we could see by this diagram flowchart that I created, this blockage of the pathway, which is what the statin works, helps to lower your cholesterol levels by blocking the major pathway. So moving forward to the cellular response, the underlying pharmacological principle here relies on a classic negative feedback loop. So basically, by blocking the specific enzyme, their liver experiences a drop in its intracellular cholesterol levels. And in order to compensate for this low levels of cholesterol within the cell, it leads to localized depletion, and the hepatocytes upregulate or increase to help mediate, and the expression of the LDL receptors on their cell surface also increase. And these newly active receptors essentially act as like vacuums now, where they actively pull this low density lipoprotein or this like bad cholesterol, if you want to consider it like that, out of the circulating bloodstream, thereby overall lowering the serum LDL levels in your body. Moving on to therapeutic uses and indications, we can it's very easy to understand by thinking about it. Like the primary medical conditions of these drugs are prescribed for people who have hyperlipidemia or hypocholesterolemia, or basically anything where they have an excess of, for example, cholesterol or like something that would induce a heart attack, right? And so both the primary and secondary prevention of coronary artery disease is also very common. And so regarding off-label uses, the statins are frequently utilized for preoperative cardiovascular risk reduction in patients that could be undergoing non-high risk but also non-cardiac surgeries. In addition, this helps take advantage of the drug's pleiotropic effects, which means the statins don't just lower the cholesterol, but they also actively reduce inflammation within the body and help stabilize existing plaques within the arteries. And you can see that in the cross section here. Moving on to the adverse effects, we have to evaluate the safety profile of these statins, and the three most common adverse effects are myopathy, hepatotoxicity, and an increased risk of mild new onset type 2 diabetes. The myopathy, presents as severe muscle pain in the body and weakness, is uniquely important. And because statins block the pathway that we saw in the previous slide, they inadvertently decrease the production of the coenzyme Q10. And this coenzyme is essential for the mitochondrial energy production in the skeletal muscle. And this loss of cellular energy is what causes for muscle aches. So for contradictions, statins are strictly contradicted in patients with active liver disease and pregnant patients. They are labeled as pregnancy category X because cholesterol is an absolute developmental requirement for fetal cell membrane construction. Moving forward, a highly significant drug-food interaction involves grapefruit and grapefruit juice. So grapefruit strongly inhibits the CYP3A4 intestinal enzyme, and because of the atorvastatin is heavily metabolized by the specific enzyme, consuming a lot of the grapefruit juice or grapefruit in general prevents the drug from breaking down. And this could lead to a dangerous accumulation of the statin in the bloodstream, which in turn could severely increase the risk of a disease, of a rapid muscle breakdown disease known as rhabdomyolysis and subsequent acute renal failure. Moving forward, let's finally take a look at the clinical application and patient education. So, as a nurse, the primary monitoring parameters include drawing baseline liver function tests and a baseline lipid panel before initiating therapy. A lipid panel should be rechecked every 6 to 8 weeks to evaluate therapeutic efficiency and efficacy. And additionally, if the patient reports severe muscle aches, checking a creatine phosphokinase or CPK blood level is mandatory to rule out the disease you mentioned earlier, which was like the muscle fatigue. And when discharging a patient, here are like three of the most critical pieces of education I would provide. First being like timing, where timing is very important, and I would educate the patient to take their statin in the evening, since the body's natural cholesterol synthesis peaks overnight while we are fasting and asleep. Second, I would instruct them to immediately report any new unexplained muscle pain or dark colored urine they might experience. Third, I would firmly instruct them to completely eliminate grapefruit juice from their diet and remind them that the pill must be paired with a diet with sustainable diet modifications to be truly effective. Thank you so much. That covers my mechanism, safety profile, and clinical applications for the HMG CoA reductase inhibitors. Thank you so much for watching my presentation.